Dr. Michael Wald, and I practice in Chappaqua, New York. And I've been practicing holistic nutrition for nearly 30 years. My father before me was a physician and a chiropractor and a nutritionist. I myself have a chiropractic degree. I can practice acupuncture in different states. And my main practice, though, is nutrition. I have 2 board certifications in nutrition. I have a master's degree in nutrition. I'm a dietitian. I'm a certified nutrition specialist. In the state of New York, there are 2 nutrition levels. There's dietitian and certified nutrition specialist, so I have those. Any letters beyond that, that someone claims to practice nutrition, they're not those things. So someone might call themselves a nutritional naturopath, for example. That's an unlicensed term. And quite honestly, if someone's unlicensed, that doesn't mean they're not really good. I'm just letting you know that there are licensed versions of nutritionists and there are unlicensed versions. So, as I mentioned earlier, I have a podcast which is every Tuesday on any podcast platform, from iTunes to whatever. So just search Ask the Blood Detective and the shows will come up. And again, I'm always open to your suggestions for topics. All the topics that I do on the show are given to me by the public. In fact, I chose these 5 topics today to present at the Awakenings Fair because they represent some of what many of you seem to be interested in. The brain, for example, which is our first talk. So I have an agenda, obviously, and I have some notations that I want to get through to make this practical in kind of a structured way. But I wanted to just ask you now if there's anything about this topic specifically that got you here that you'd like me to focus on. So maybe some of you are concerned about not losing your brain in terms of dementia risk, okay, or loss of memory, right? Who's interested in that? Okay, good, a lot of people. And you know, you should be interested in that because it is a devastating disease that affects a large percentage of the population. When I think about dementia and memory loss, I think about special needs conditions. They're epidemic. They're just getting worse and worse and worse. So I've looked at some of the more common factors that people are exposed to that might have a thread among all. Let's say, for example, inflammation or heavy metal toxicity, for example. So, well, let's talk about that for a minute. So we have a brain, and our brain is made of 2 lobes, and it's got a cerebellum in the back, and it's got a brain stem, and then the central nervous system is in the center of the body. And then it has peripheral nerves which go out to the sides and extremes of the body that innervate or go to everything. Now you might say, well, I kind of knew that, so what? Well, let's say you have a gastrointestinal problem. Let's say it's leaky gut syndrome. That could be caused by a neurological problem, not a gut problem. The gut may just be the affected organ, okay? Just like if someone has a stroke in their brain over here on the left side, let's say towards the center median point here, they would likely have issues with movement on the opposite side of their body near their feet or lower leg, because that's the area that controls that part of the body, okay? So if you have, let's say, what I might call minimal brain dysfunction, which is not dementia, but it's some minimal changes in the brain, and don't let that word minimal fool you. It's like saying someone had a mild heart attack. There's nothing mild about it. Or your doctor's telling you, I hear this all day long, you're borderline diabetic, as if somehow you're sitting on a fence or something. You know, which means if you're borderline diabetic, you've got a blood sugar hemoglobin A1C of 5.7%. The damage occurs then. If that goes any higher, see what happens is you have normal tissue here and normal blood sugar and abnormal blood sugar. As the blood sugar moves from, let's say, right to left, the damage to various aspects of the brain increases. It doesn't just start when the doctor says, oh, by the way, you're borderline, or by the way, you're diabetic. All of this time was when the damage happened. So by the time the diagnosis happens, it's extremely advanced to what's going on in the brain or anywhere else in the body. So blood sugar issues don't just affect the brain, they affect everything else. So back to the structure for a minute. So you know that depending on where you damage the brain, you might have various symptoms. So if you have issues with the frontal lobe of your brain, you may have migraines, or you might have depression or anxiety, all these different things. Sometimes we'll say that these concerns are genetic. Sometimes they are genetic, and sometimes they're epigenetic, meaning you have your genes, they're fine, but the environment has an impact upon them, an epigenetic impact that then transforms the expression of the genes in the body, which is your genetics, which encode for certain proteins, which then tell your body to do certain bad things, let's say. So, in terms of saving your brain, you first have to know what it is that's affecting your brain so you can save your brain, right? So if you, again, are concerned about dementia, let's say an Alzheimer dementia type, because not all dementia, not all brain loss is from an Alzheimer's type of dementia. It might be because, as I mentioned, the accumulation of toxic metals in the body, and metals like mercury, aluminum, cadmium. Arsenic's not technically a metal, but it's generally checked on those tests together. And there are many others. Those are fat soluble, meaning your body will take those in from breathing, eating, or injection, let's say from certain vaccines, and the body will want to store those toxic, those fat soluble toxins in fatty tissue, the breast, the brain, the entirety of the nervous system. So you can have muscle weakness, you can have fibromyalgia from all of the brain stuff. You can have endocrine or hormonal issues because the nervous system is affected, and the nervous system goes to the thyroid, and the nervous system goes to the adrenals. But you go to, let's say, some astute holistic provider that says, well, your adrenals are blown out. Okay, why? Stress? Okay, great. So what's your evidence for that? So I look for causes. And it's almost never just one cause. Even if your brain degeneration started from one place, let's say heavy metal exposure, the heavy metals are dangerous because they set up an inflammatory environment, which we all now know is bad news. And we know that inflammation is probably the most persistent underlying cause of all human diseases, if not all diseases in mammals across the board. So our brains are extremely susceptible to environmental insults. One of the other reasons for that is that you breathe, right? So when you breathe, you have your smell nerves, we'll call them, right? They're not really nerves. The definition of a nerve in medicine is that it's something other than brain tissue. So they're called nerves because we just got it wrong with the early anatomists, but the reason I'm telling you this is, think of the brain as this big piece of clay. And let's say you want to pull something out of it, like a wormy little extension, right? So you kind of play with the clay and you pull it out, right? You do that, nice thin little wormy things. Here's the clay. And those wormy things are your olfactory nerves, which are your smell nerves. So these are actually not nerves. This is the brain, literally here. You only got about 4 inches for you to get anything practically that's toxic from breathing it right into your brain. It doesn't take a whole lot of movement to do that. And we know that this happens because we know, for example, you can become toxic from metal accumulation simply by breathing it, right? And then another way would be eating it. And then sometimes you can even rub it on the skin and it can go, transdermally into the skin. Any feedback, any questions, clarifications on metals and the brain degenerative process? The evolution of human beings involved some human beings living close to the shorelines, right, around the planet. And because they lived close to the shorelines, they ate diets much higher in omega-3 fatty acids. And that caused the brain to grow. The higher the dietary essential fatty acid intake, the larger the brains and the larger the cranium. Now those individuals, early hominids that lived elsewhere on the planet away from the shore, they didn't have diets that were as high. So they weren't as clever, they weren't as smart. So when you hear about the paleo diet, you should start to be thinking now how ridiculous that actually is. Because there is no paleo diet. That would be like saying that all people over 50 eat this way. It's ridiculous. It doesn't even deserve much of a comment, right? So the reason why the paleo diet is ridiculous is because, number one, there's no paleo diet, because there's a diet for certain people that live near the shorelines, there's a diet for people that live over here, and then there's all over the planet. And even if you can somehow mix them all together so they reproduced and mixed up their genes with their individual diets, and maybe there's some sort of similarities now, which never happened, maybe we can have a conversation about a certain way to eat. But even that would be ridiculous. Because even among a given individual, their dietary needs may change over time for a whole number of reasons. How you age, if you're not aging well, if you're on certain medications, if your sleep is terrible, if your stress is terrible, if your toxin exposure is another thing. So when it comes to what is the best diet for the brain, which is what I'm getting at, I'm not saying there's certain concepts within this paleo conversation that are useful, but there is no paleo diet. Just like I try to explain this to my patients, is that there may not be an optimal diet for you for your entire life. So for example, I eat a certain way because of a diagnosis I had when I was 18 of multiple sclerosis. So my dad was an astute doctor and he put me on what I needed to do, and that was great. But as I grew up and different things happened, my growth, then I wanted to become this athlete and run marathons and do karate and lift weights, all these different things. My nutritional needs obviously changed on top of that baseline, right? And then because of just aging and how it affects our nutritional needs, unless you look at some of your chemistry to see what's not quite keeping up, because you don't feel everything happening with your chemistry. I had a patient, well, I have lots of patients like this, but a woman who came in just a few weeks ago who was, she looked completely healthy, even athletic, and she was riddled with cancer metastasis. So no symptoms at all. She came in for just a checkup. So my point is, it's a good thing to look at your chemistry. Now, what does that have to do with what you should eat for the brain? Well, if I say to you, well, omega-3 fatty acids are great for the brain, and that in the nervous system, that certainly is true. But is that appropriate for everyone? If you're on anticoagulant medication, it's not good. You don't want to take a vitamin E or omega-3 fatty acids or any nutrients that cause blood thinning if you're on blood thinning medication, because you can hemorrhage. You could bleed too much. That's why the doctors, if they're smart, tell you don't take those things. But they don't tell people this because they almost never ask, because the patients come in with me and I find it, and I said, well, you need to stop taking that omega-3 because you're on Coumadin. So that's a problem, you see. So there's no optimal list of nutrients, there's no optimal diet. So that needs to be determined. So how do you do that? And let's talk more about the function of the brain though, so you understand the nutritional relationships. So we talked about omega-3 fatty acids as probably being something to consider at the least, right? Because omega-3 fats, when you eat them, they saturate the fats in the body, including the brain and the nervous system, with high levels of omega-3s. Omega-3s also cause a reduction in inflammation and also reduce stiffness of brain cells. Omega-3s add flexibility to tissues, and flexible tissues are younger tissues and they act younger. So that would be a reversing aging part of the brain. So you're born with a brain that's very flexible, and it ends stiff, 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 and then finally you're a stiff. But seriously, it's interesting, I gotta write that one down. Well, when I think of this, and of course I'm exposed to so many patients, when I first started practicing, I wasn't really the best example, let's say, of natural health. I mean, I was and I wasn't, just like any person. But after being exposed to so many people, so many issues, and seeing so many of them getting well, I just know too much not to do things for me, so now for me it's become just second nature. Yes?
Can I ask a question
Please.
now? Okay, just with the whole fatty acids and omegas.
Yes.
Back in the day, hundreds and hundreds of years ago,
Yes.
you could eat the fish and they weren't toxic. Now, pretty much, the fish, a lot of mercury, a lot of, what are they, CBDs, whatever. Not
Other
CBD,
toxins.
other toxins. So, you have to go to the supplements, correct?
Sometimes.
Okay.
I can't really tell you for sure that the omega-3s in the past and the fish were cleaner, because I wasn't there. But there are natural toxins in the Earth's crust.
Toxic.
Yes, I know what you mean.
is
I know what you
I
mean.
meant,
Yes.
yeah.
So I think it's definitely safe to say that they're more toxic now. So I eat fish, not particularly often, but I do eat fish, but I take chelating nutrients to offset the heavy metal accumulation. Because I checked my labs, the heavy metals were present, I took the nutrition, I was able to continue to eat my food, have my cake and eat it too, while my body was detoxing. Another way of doing it is you just stop eating those foods. There are non-fish sources of omega-3s. They don't work nearly as well, but they're there. Flaxseed oil, for example, is one example. That's a combination of omega-3, 6s, and 9s, but I don't recommend that to anyone ever. The reason I don't recommend flaxseed oil is because the omega-6 content is very pro-inflammatory. That's what omega-6s do. They upregulate genes which encode for proteins which cause inflammation. So, and then if you feed chickens omega-3s and then you advertise in health food stores that you have these omega-3 enhanced chicken diet eggs, well, then you fry your eggs, then you oxidize your flaxseed oil and fats, and you make it one of the most dangerous things you can possibly consume. So oxidative food products like trans fats and saturated fats and heated fats of any type, even the healthy olive oil, if you heat it, you're killing it. So when you cook with oils, if you're going to cook with oils at all, use as little as you can. Olive oil is probably the best place to start, and use as little as you can and cook on a low temperature over a longer period of time rather than revving it up, because you create more what are called free radical molecules, and these free radicals cause oxidative stress, which means when you eat those foods, they release these highly reactive molecular free radicals, and they're like an infection. They spread everywhere, and they disrupt and interfere with normal physiologic reactions. So we'll talk about this later more in the aging talk we're going to have today. But one of the major theories of how human beings age is because of the oxidant theory of aging. So due to inflammatory oxidative stress, you can sort of think about oxidation and inflammation as sort of the same thing, slightly different, but they're related in the sense that they're always there together. Is we want to reduce our oxidative potential. So we're not going to cook with those poor fats, and if we do, we're going to pay some attention to what I just mentioned. And very quickly, if you're going to use an oil, again, I think it should be olive oil, and it should be in a tin, okay? That's the tins that you see in stores, those don't leach metals, by the way, not to worry about that. And the oil isn't exposed to light. So you want to protect your oil from light, heat, and air, because light, heat, and air cause oxidative inflammatory stress to the oils, and then you cook with the oils, you worsen it again, then you eat it. I can't think of a worse thing that you can do. So you want cold-pressed, imported Italian olive oil. That's what you want. That's the best form. It has the highest levels of antioxidants naturally. So we oxidize as human beings. Our brains degenerate due to oxidative stress. Our brains degenerate due to inflammatory stress, okay? Our brains degenerate due to an absence of proper protein, because 80% of the neurotransmitters in your head are made from proteins that your body breaks down to amino acids, and the amino acids make neurotransmitters. And neurotransmitters are chemicals like serotonin, you've probably heard of, and dopamine, right? Things like that. And those hormones allow for thinking, reaction, thoughts, emotions, feelings, everything. The nervous system is, everyone says in natural medicine, it's all about the liver. Thinking that something is all about the liver is a very incorrect, way of thinking, because it's either the liver or it's not the liver. Well, that sort of black and white thinking is not only limited and wrong most of the time, it's harmful for the brain. It's sort of like using a language that's wrong, and our brains aren't designed for it. But that's a whole other conversation. I'm very much into how the brain uses language and thinks, and something called semantics, and how we can have toxic language that creates disease in the body just because we're using that language. Again, another conversation. So we said that the brain is susceptible to a number of things. One of them I didn't mention yet was the decline in hormones that we all experience over the course of our lifetimes. Some of our hormones decline more rapidly than others. And even if they don't decline, the body becomes insensitive to these hormones. So this is why you're mostly wasting your time and money with hormone testing. So I did a short talk on Channel 11 Picks. It's on the website under the video section. I was on, and there was an endocrinologist on, I think before or after me. He was talking about estrogen, I was talking about testosterone, and they asked us both the same question. They said, okay, so how do you test this? And we both said the same thing, that you could look at these hormone levels from saliva, urine, blood, whatever, but hormone levels almost never reflect the way the body uses the hormone. So if I am the tissue and this is the hormone, if this hormone, let's say, is the adrenal hormone DHEA, okay, not DHA, which is the fish oil, DHEA, that's the adrenal hormone, that starts to decline when we're about 30 years old, and it precipitously just declines. So if that hormone is declining, you would hope that the tissue receptors, so think of like cups on me here, these are receptors, they want to receive the hormone. So there's less of this hormone. So you want these to open up just to make more out of this, so you're actually functioning as if the level's not low. Make some sense? Mm-hmm. Because the receptors has increased sensitivity. Now you've heard of insulin resistance, right? So insulin resistance means you can have tons of insulin, but the body's receptors are shutting down to the insulin because there's so much actually to kind of balance out the ultimate relationship. But when that process is too prolonged and degenerative, then this becomes abnormal. So these are normal reactions that when they persist, like even a stress reaction, a certain amount of response to stress, increased heart rate and blood pressure and reaction time, and all of this is a normal thing, adrenal hormones. If the stress is chronic and ongoing, then the body just breaks down. So through questionnaires and detailed interviewing, that's how I figure out the best hormones. I'm not saying that I never will do a hormone test, but it depends on the situation that might lend itself to a better hormone evaluation than another, but ultimately that's a limitation in hormone testing, okay? So think of the brain, again, it's made of these fats, we talked about that. It requires neurotransmitters. Sure. It requires neurotransmitters which are made of proteins, specifically amino acids. Now what if you are over 50? If you're over 50, then you have a 60% chance of malabsorbing. That means not absorbing normally what you eat. So another one of what I would call a blood detective blunder is some of you weren't in the room when a couple of you and I were talking about errors in thinking about this sort of thing. I call them blood detective blunders because if I say to you, you are what you eat, we're like, oh yeah, I've been hearing that my whole life. But you're not what you eat. You are the results of what you absorb from what you eat. And when I say that, you should completely accept that, right? Or if you don't, I would love to hear why. So you're not what you eat, you are at least what you absorb from what you eat. But if you function as if you are what you eat, then you'd be like these patients that have come to me forever, say, I don't understand it, Dr. Wald, I'm not getting any better. I ate the perfect diet, I looked at the book, I even looked in your book. You're not a book. We don't know what your absorption is. You may be malabsorbing, that's almost always the case. So you can take all the perfect nutrients you want, eat the perfect diet that you want, and you may not absorb what you're eating. So you end up being the consequences of what you malabsorb. So if you malabsorb proteins, and there are tests for malabsorption that are actually accurate. So we can look at that. And if someone is malabsorbing proteins, then they may have amino acid deficiencies, because amino acids come from proteins, and they may have issues with their brains because that's how the neurotransmitters are made from the amino acids in the diet, at least 80% of them, which is a lot, okay? And the brain is also called, well, the gut, actually, I should say, it's also called the second brain, because there's a heavy nerve innervation to the intestinal tract, and there's more serotonin, that's a neurotransmitter, in the gut than there is in the brain. Now, who cares? Well, because this new branch of medicine has finally figured out that there's a connection between this. I laugh about that because it's, so when I was talking about wrong language leads to wrong thinking, which could lead to pathologies, if you say that something's connected, you're implying that it was somehow disconnected, that you connected it. But this is all one thing. Like, for real it is. And everything that you think is separate from you, you know, philosophically at least speaking. So, but if you relate to it as these are separate things, then you develop schools like medical schools and others that separate out all the different parts of the body into the hormone study and the inflammation study, internal medicine here, endocrinology over here, gastroenterology over here, OBGYN over here, cancer toxicology over here. And the students that have not very well formed brains either at age 20, and they know nothing except their mommies and daddies said you're good in math and science, you should be a doctor. So they go to school and then they can't distinguish between these error problems and semantics. So they treat people as if they're parts. And of course, no matter how well you do in that, let's say you're the smartest person working with parts you can possibly be, you're inherently limited within that construct of language. That's what I meant. So if I say think holistically, and you're like, yeah, okay, well, what does that even mean? What does thinking holistically even mean? Well, it might have something to do with thinking about the relationship of things. Okay, so that's a start. And then if you started to think that way, then you might say, well, maybe something I'm breathing, eating, someone I'm being exposed to, or something might, look at as many things sort of as possible, would be closer to thinking and acting holistically. If you don't think like that, and let's say you think more medically, because I went to medical school, I went to chiropractic school, I went to acupuncture, I did nutrition. The thinking is all different, pretty much. And everyone thinks they've got the answer, and everyone thinks they're open-minded and all the whole thing, but they're shut down to each other. So you ask, let's say, an acupuncturist, what's the cause of all disease? They'll say, well, energetic imbalances, energetic imbalances. I'm simplifying. And then if you ask a physician, they would say, well, people are stressed and we don't really know the cause of most disease. We don't know why people are having more cancer. It probably has to do with diet as some factor. That'll be one of the first things they'll say. But then when you ask them how much nutrition education they have, they say nothing. The average medical school education of about 7 years is 23 hours of nutrition education. And there was a quote out of Harvard about this that said, if you watch TV commercials, just TV commercials, you probably know more nutrition than your medical doctors do. So my point is that people go from doctor to different doctor and practitioner, and they buy the concept as opposed to integrating it all. Even saying integrating is wrong semantics because there's nothing to integrate, it's all the same. But it's not the same unless you view it the same. So when it comes to the brain, you want to view this, the brain is susceptible to just about any influence that you can expose it to, because your awareness of anything is through the nervous system. What you see, what you feel, what you smell, what you taste, and all sorts of sensitivities beyond that. Without your brain, one could argue there's no existence, particularly if existence means that you perceive the thing you're existing. But if you're not there, if you don't have a brain and you're dead, let's say, is there anything there? Anyway, I'll leave you with that later. It does have a practical application though, because if you think of the brain as being susceptible to various things, you might start to look at what it is about your brain health and what it is about your environment that may be affecting it. So sleep issues. If you're not getting adequate sleep, and adequate sleep needs to be defined for the individual, but it's something like 6 to 9 hours, something like that. A stage 3 REM sleep. If you're not getting that proper sleep, you stress out the nervous system, which means hormones may decline, messages from the brain to the gut, which is the second brain, might not work very well. So you might get an intestinal issues, but have no clue that it's actually your brain, you see. Your brain innervates, as I mentioned, every single thing in your body. So I had a gentleman come in several weeks ago, and he had a weakness in his leg, and he had gone to a bunch of doctors, and they had thought it was a vascular issue. But it turned out that he had a plaque on the opposite side of his brain, which is an inflammatory, hardened part of his brain in the area that innervated that leg. You see, so any number of symptoms can result when the brain is damaged, and they can be very subtle too. They can be extremely subtle. Any feedback, questions about anything I've said so far? Yes.
How would you find out what's wrong with the brain?
Okay, so there's a couple of different ways. Depending on what the injury or injuries are, you may have had a physical accident that might require either an MRI of your brain, possibly a CT scan of your brain. MRIs, by the way, there's no radiation. CTs are very high levels of radiation. So with my patients, I put them on like pre-radiation nutrition to offset some of that exposure. But to answer your question, so it might be those images, there may be other imaging techniques. There are neurologic exams that check all the cranial nerves and the higher centers of the brain. So an astute doctor, and I do, of course, neurologic exams on patients as well from head to toe, and you find deficits in the senses. And since you know the anatomy of the brain, you actually can know where it is. And then if it's an area of the brain, let's say that's affected in dementia, like the basal ganglia of the brain, and you know that area tends to develop what are called, they're basically degenerative plaques. If you know that, then there's certain nutrients you might use to target that area of the brain because you know that's the sort of thing that happens there. Another way of examining the brain indirectly is by measuring urinary amino acids and neurotransmitter levels. So there is a rough approximation of the amino acid deficiencies and neurotransmitter deficiencies you'll see in the urine that you might find in the brain. So they looked at the cerebrospinal fluid that circles the brain, and they looked at the urine. There's a high correlation. So you can see if people are low or high or imbalanced in some way in various neurotransmitters, and then you can attempt to correct those. In terms of further assessments, there are many others. It really just depends on the presentation of the person, because given what the problem is, you would choose a certain set of evaluations, but it may include some of the things I just mentioned. Yeah.
Does the brain affect, let's say, cholesterol problems or thyroid problems?
Okay. That's a great question. So does the brain affect cholesterol or thyroid problems? Now you might think, like off the top of your head, no pun intended, that's kind of like a silly question. What does cholesterol, or thyroid have to do with the brain? Well, in hypothyroidism, which is low thyroid, there's a much greater propensity for brain atrophy. The brain tends to shrink at a much greater rate. Not always, but it often does. And the brain has a large amount of cholesterol, which helps the structure of the brain be maintained. Cholesterol in the brain acts like a sponge to soak up oxidants, which are bad. You might say, cholesterol? I thought cholesterol was bad. No. Cholesterol is cholesterol. Too much cholesterol is bad, but you need a certain amount of cholesterol, between 0, the labs say, and 200. It's quite a wide range. My blood detective interpretation that I outline in my book says that for the least amount of disease, cardiovascular disease at least, you want a cholesterol between 160 and 165. So in medicine, they would say, hey, you're 150, and that's the same cardiovascular risk as 199 because they're in the range. But that's wrong. It's just, obviously the higher your cholesterol, the greater your risk of cardiovascular disease. But because they have these wide ranges in medicine, they miss a lot of things. Back to your question. So if you have a hypothyroidism, that also increases inflammation in the body and the production of antibodies if it's Hashimoto's hypothyroidism. And those antibodies can react adversely with brain tissue. So again, the brain usually shrinks. When it shrinks, that means you're losing neurons, or your neurons are shrinking, or those are nerve cells, or the neurons are becoming more fragile, and can affect anything at all, because it's all there in the brain. And you can, of course, have symptoms elsewhere. So a person who has hypothyroidism might be fatigued, they might have brittle hair, nails, teeth, they might have bone loss, they might feel somewhat depressed, they may have brain fog, their cholesterol tends to go up, because hypothyroidism means that the metabolism is lower, right? That's why people tend to gain weight. If they don't gain weight, they tend to gain at least fat, but sometimes they don't notice it because they're losing muscle mass and organ mass, which when that happens, that's aging. And the less lean mass you have, that's where your metabolic rate lives. So with hypothyroidism, you don't have the thyroid hormone to trigger metabolism in muscles and organs, so they start to shrink. And then you have all the other health problems associated with that, which could also impact cholesterol levels directly, so cholesterol goes up. That's a quick response to that. Okay, yeah, and since thyroid receptors are on every single tissue in the body, not all hormones have receptors everywhere, anything can happen with hypothyroidism in any medical specialty, which is why people run around for years and years from doctor to doctor, because they don't put it together, because they're not thinking holistically correctly. They could be super smart. And some of my patients say, Dr. Well, do you know who I'm seeing this person? And I'm seeing this person. So clearly the doctors have told these patients, look how great I am, but they can only be as great as they can be in that limited slither of their thinking. Once you open the holistic realm, there's a lot more opportunities there. Okay, was there another question that I saw or input? Okay, yes.
Do hormones affect cholesterol?
So the question was, do hormones affect cholesterol? The answer is yes, they do sometimes, and sometimes they don't. So it depends on the person. So for example, if as you grow older, your DHA adrenal hormone goes down, or your thyroid hormone goes down, then cholesterol tends to be overproduced by the liver. That's one mechanism of it. There's many others. Just like when we age, we have more inflammatory stress. We have a chronic level of low-grade or moderate or even high inflammatory stress. So the body increases cholesterol because it's an anti-inflammatory. And then, unless that process is interfered with, it becomes a perpetuating negative thing where we have too much cholesterol and it just keeps going because inflammation is driving everything. Okay?
Because, the last few years I've gone through menopause and my cholesterol was always 150 for years, and my triglycerides were 50.
Mm-hmm.
Now it's 200, my cholesterol.
Yeah.
And it's been that way for the past, since I've gone through menopause.
Yeah, and menopause brings up another unique situation where you need to consider your estrogen decline as well. So estradiol, which is one of the 3 kinds of estrogen, will tend to decrease, and that can cause all of these problems as well, including high levels of cholesterol.
Now, is that something to be concerned about? Or?
Well, yes, because the higher your cholesterol, the higher risk of cardiovascular events. So it's not a crystal ball, but it's a factor. And then if the person doesn't exercise, that increases the risk even more. If they have any borderline blood sugar or anything else, that would increase the risk even more. If they're overly stressed, that would increase it even more. And we can go on with the list. So we handle the diet, we think, hey, we're good, but we're miserable people and those stress hormones matter, right? Or we're just not acknowledging our sleep. Or another common thing with my patients is that I'll review these various things and I'll say, okay, let's talk about exercise. I'll say, oh, don't talk to on the screen, I exercise. Okay, what do you do? Oh, I'm really busy. I'm shopping and I'm running around all day long. I said, well, my grandmother does that too, but that's not exercise. Sorry, and she's dead. Sorry, Grandma. So she said I can do that in the future when she was alive. So there's a lot of factors, obviously, that influence the health. Then let's say your diet is deficient in healthy fats, your brain will suffer because it's made mostly of fats. So if your diet is devoid of, let's say, olive oil, which is omega-9 fats and omega-3 fatty acids, then you're gonna have less brain structure. And again, that can affect everything from your math skills to your irritability to everything. So I'm doing a podcast soon about mental health. It's gonna be called something like mental and elemental nutrition. And you see that with a lot of these diagnosed health problems, mental illnesses, even many of the special needs conditions, they are really the side effects of improper brain nutrition. So the brain also stores some of the highest levels of zinc in the body, particularly the area of the brain that coordinates many areas of the brain and connecting them together to make sense out of a global sort of bit of information. So what that means is that if you're deficient in zinc, then your brain can obviously suffer. Zinc has, it affects nearly 200 different enzymes in the body. And enzymes control the rate and speed of reactions, which are occurring all the time, that if they're going in a positive way, you're doing great, and if they go to a negative way, you're not doing so great. But zinc deficiency is extremely common now, and it's going to be even more common because COVID and viral infections dramatically increase zinc need.
Mostly all the minerals, right? Potassium, zinc,
Well,
magnesium.
true, but we want to be careful not to generalize, because that's sort of like black and white thinking, but in an opposite way. Almost every generalization is
But
wrong.
COVID is doing that.
COVID may do that with a given individual. So if I check their zinc levels or check tests of the speed of their white blood cells, that's another zinc test. I might want to supply my patient with zinc. There are also many different symptoms of zinc deficiency, too numerous to mention here, but a lot of them look like all the brain issues you've ever heard of. So you would want to figure that out. But let's say you're taking zinc and you also take some nutrients, let's say for chelating metals that are in the air all the time. Those chelators will chelate the zinc as well. So the order and the combination of nutrients that you take matters. I'm going to do another podcast on the role of metals and the role of, but specifically how to properly take nutrients. Sometimes you want to take certain vitamins and eat certain foods. You want to time it, let's say between your exercise, or if you want to not have nutrients interact in adverse ways, you want to take them apart by at least a few hours, like N-acetylcysteine, one of the most important nutrients on the planet right now. I don't know if you know NAC, ever heard of that? So NAC is now off Amazon because there are way too many positive COVID studies with NAC. They just pulled it off. You can't even get a product with it in it. But it's a powerful chelator, even in medicine. In medical circles, NAC has been around forever. And it's better than EDTA and DMPS and DMSA. All those other ones have a lot of toxic properties. Practitioners just neglect to tell you. But I bring this up because if you were taking NAC to offset metals, but you were also taking zinc, which is a metal, you can chelate that. And that means you're going to bind it and it's going to be excreted. And you can take all the zinc you want, it won't matter. And of course, there are different forms of zinc. So let's go back to omega-3s in the brain because we started with that. So we say omega-3, so what are the best sources? I mentioned that flaxseed oil is not the best source because it has omega-6s in it, and omega-6s are pro-inflammatory. Omega-3s are anti-inflammatory. And we know exactly how the chemistry works. Omega-3s increase the levels of prostaglandin E3 in the body, which sets up all these anti-inflammatory scenarios. And the omega-6s upregulate all of the inflammatory pathways. So I'll have patients come to me and say, it's usually women, and they're taking like evening primrose oil, which is omega-3. Which is omega-6. And you do not want to be taking that under any circumstances, even though there may have been some reasons to take it, there are better options. So there's a more or less better option for different people who have concerns with their brain. So the best sources of omega-3, optimally speaking, when we're talking about food, would obviously be, tuna, mackerel, salmon, but I would definitely take a chelating agent with that. Now, the chelating agent that I choose might be different from person to person depending on them. So if a person comes to me and they have weak, let's say, kidneys, I'm not going to give them a chelator that usually works by eliminating things through the kidneys. It'll stress their kidneys out. So I might need to give them a different chelator that removes it through the stool, you see. So you don't usually hear these subtleties for some reason, even among people in my profession. The only explanation I can give you is because they don't know it. Because I don't see anyone who can know this and do something else. So we said the brain is a structure, omega-3 fatty acids. It requires neurotransmitters, which are made from amino acids. And then you have to digest amino acids. So you can have brain problems because you have malabsorption. You can have any problem in the body, anything, all stemming from malabsorption. And you don't have symptoms of gut stuff. You just have the symptom of malabsorption, which could look like osteoporosis. What? Yeah, if you malabsorb calcium, then you're going to get osteoporosis. Your body's going to pull the calcium out of your bones, and it's going to say, where do I stick this stuff? Well, look at all this inflammation in this wonderful body. Look at all the inflammation in the blood vessels. So I'm going to stick the calcium in the blood vessels. That's atherosclerosis. I'm going to stick it in the brain, causing all kinds of neurotransmitter issues by stiffening the brain. Thank you. And also you might have fibromyalgia type symptoms or joint symptoms or musculoskeletal stiffness, all from calcium deposition in tissues, all from malabsorption. And of course, if you're malabsorbing calcium, you need calcium for neurologic function. Most people don't seem to know that. So that's really, really important as well. And you can take all those minerals. You want to be careful because minerals can be more toxic than vitamins. That's a general rule. Minerals have a very short range of non-toxicity to toxicity, and vitamins are water soluble. So usually most of the vitamins, if you take too much, your body will remove some. But that doesn't mean you take it in, it uses what it needs to use. A lot of times people take it can't get activated for various reasons, it's urinated out and nothing happens. So again, if you have low stomach acid and you're not going to activate a lot of nutrients, you can't extract your B12 from your proteins in your diet. You need B12 for neurologic function, you see. Or you might say, well, no, doctor, I have leaky gut syndrome, I know that, I have leaky gut. Well, that's only a description. That means nothing. That just means you have a leaky gut. If I hit you in the arm enough times, you'll have a leaky arm. So what was the cause? You might say, well, my punch. And then I would say, well, no, it was my childhood because that's why I punched you. Because you look like my mother or whatever. So my point is, you want to actually try to get fundamental causes, if you can, and manage them. Because those fundamental causes can lead to all kinds of craziness and misinterpretation of how things are going. So we're going to end after this question. Yes, and there's a sign-in sheet going around. If you would like to be put on the list to get a free copy of these two books, I'll be giving away about 6 of them. The Encyclopedia of Anti-Aging Tests, there's 170 tests in here, how to nutritionally and medically interpret them, and my Franken Foods book. Just sign away, and also let you know when my podcasts are, which is, by the way, every Tuesday on any podcast platform. Just search Ask the Blood Detective. Hold on. What's your question?
Can a blood disorder or blood disease lead to cancer?
The question was for a blood disorder
Or a blood disease lead to, I'm sorry, brain. Can a brain disease or brain disorder lead to cancer?
Can a brain disease or brain disorder lead to cancer? Sure. It's a little vague, the question, but if you have inflammatory brain disease from whatever reason, let's say inflammation, those inflammatory chemicals, they're physical chemicals, they circulate. And if they circulate enough because the inflammation is chronic enough, you'll harden your arteries. Or you will cause inflammation, which will upregulate certain genes, which encode for certain proteins that might give you anything from 1 of 800 different cancers or beyond that, or anything else. Yeah, so that's the general gist of it. Did you have a question?
I just want to know if your book was on audio tape.
It's not an audio tape. Well, that's a really great idea. And I do like to hear myself speak, so I might try that. All right, so I believe we're going to end in just a moment, so I just wanted to reintroduce myself before we end. So my name is Dr. Michael Wald. I practice in Chappaqua in New York. I do holistic health. All the information on me you can find on my website at drmichaelwald.com. and my blood detective website is my nutritional line. They both link to one another. So if you get confused and go to the website for nutrition trying to find me, just look up my name, okay? All right, I want to thank you all for this introduction. The rest of the talks, we're going to include certain aspects of this and keep building throughout the whole day. So I hope you find it useful. Thank you.
Thank you so much.